Hello and welcome to our presentation of Understanding and Harnessing the Power of Probiotics. My name is Catherine Mulvale, and I'm the Executive Director for the Canadian Digestive Health Foundation. Thank you very much for joining us. The Canadian Digestive Health Foundation is here to help you. We are the foundation of the Canadian Association of Gastroenterology and are supported by physicians and scientists who specialize in digestive health and disease. It is our mission to empower people like you to take control of your digestive health with confidence and optimism. Our objectives for this evening are, first of all, to welcome you and let you know that you are someone interested in probiotics and that you're not alone. We have over 100 registered for tonight's session. Next, we want to introduce you to Dr. Philip Sherman, a physician and probiotics expert who's here to help you better understand probiotics and make good decisions about these bacteria. And finally, we're here to answer as many of your questions as possible. The Foundation would like to thank Activia for sponsoring this event with an unrestricted educational grant. Activia is a strong supporter of the Canadian Digestive Health Foundation, and without their support, this session would not be possible. We hope to provide each of you with information that you can use in your everyday life and when speaking with your health partners. Our expert this evening is Dr. Philip Sherman. Dr. Sherman is Professor of Pediatrics, Microbiology, and Dentistry at the Hospital for Sick Children, University of Toronto, where he has been on faculty since 1984. Dr. Sherman completed his medical school at the University of Calgary in 1977 and did his training in pediatrics at the University of California, San Francisco. His training in gastroenterology and research was completed at the Hospital for Sick Children in Toronto and the Walter Reed Army Institute of Research in Washington, D.C. Dr. Sherman is a past president of the North American Society for Pediatric Gastroenterology, Hepatology, and Nutrition, and a past president of our parent organization, the Canadian Association of Gastroenterology. He is the recipient of a Canada Research Chair in Gastrointestinal Disease, and his research program is funded currently by the Canadian Institutes of Health Research and the Crohn's and Colitis Foundation of Canada. His research interests focus on epithelial cell signal transduction responses to pathogenic, commensal, and probiotic bacteria. Dr. Sherman is also the scientific director of the Canadian Institutes of Health Research, Institute of Nutrition, Metabolism, and Diabetes. Dr. Sherman will share some of his insights with you to help you better understand what probiotics are and analyze their effectiveness in treating and preventing disease. After Dr. Sherman's formal presentation, he will answer the questions you sent in when you registered and those you typed for us during the session. Now, I'll turn it over to our expert. Welcome, Dr. Sherman.
Thank you, Catherine, and hello to everyone who's on the phone. I'm sorry I can't see your faces, but I understand that you're out there, and I'm delighted that you've taken time out of your schedule to join Catherine and I to have a discussion about probiotics. I have had a series of questions in advance of the presentation, and I must say they are excellent questions, very wise. I don't have all the answers to all the questions. This is a rapidly evolving field, so I'll try to answer as many as I can during a presentation and then going through the list of questions that were given in advance and that you can submit now. So in my presentation, I'm going to be discussing at a high level about probiotics and where they can be used and what are the unresolved issues. Specific questions about your own healthcare needs or those of a family member, you need to take them in context and certainly discuss them with your healthcare provider. So I think you saw the list of, I do work in the probiotics area, so I do have conflicts of interest related to research by a Canadian manufacturer of probiotics as well as companies that are interested in putting probiotics and prebiotics in infant formulas. So I'm going to discuss what is a probiotic, and I hope by the end of this evening you're going to leave very clear about what a probiotic is and is not. Discuss the term dysbiosis, talk about a rapidly emerging field, understanding the normal microbes that live in our intestinal tract and in health, and what's aberrant or altered in various disease conditions, including gastrointestinal diseases, including irritable bowel syndrome, shortened to IBS, and inflammatory bowel diseases, or IBD, which the two most common forms are Crohn's disease and ulcerative colitis. I'm going to talk a little bit, so there were some questions asked by individuals who are on the phone about how the probiotics work and how do various probiotics work. Talk about their effectiveness, should they be used in a prevention strategy or an intervention strategy. And as I say, if I don't answer your specific questions, please type in as Catherine instructed. So let's see if I got this working. Okay, so what are probiotics? The terminology here is that the World Health Organization got a group of experts together to agree on the terminology, and even experts in the field continue to argue about this, but the current definition accepted by the World Health Organization is that the organisms, small microscopic bacteria, they have to be alive. So not all preparations that one sees advertised as probiotics, if you test if there's anything alive in it, in many products, commercial products, there's nothing alive. In other products, there are organisms present, these beneficial microbes, but it's not been shown that the product or the organisms in that amount in that product are beneficial to health. And to be considered a probiotic, a preparation has to have both live organisms and be of benefit to health. So that something that's derived from live organisms might be benefit to health, but it's not a probiotic. It's a probiotic-derived product, or it's something else, but it's not a probiotic. It has to have the live organisms. Most often, this is the third bullet point you see on the slide here, most often, but not always, these organisms are present in the intestinal tract of healthy individuals, especially breastfed babies have very high levels of these beneficial microbes called lactic acid-producing bacteria, or lactobacilli and bifidobacteria. But other organisms have been used as probiotics, including a yeast that is closely related to, but not genetically identical to the yeast that's in baker's yeast. And as I mentioned, not all, but the two common groups are lactobacilli and bifidobacteria. So do probiotics have an impact on health? I think the explosion of literature in this field in the last 20 years, the answer is yes. But which probiotics, at what dose, in what specific clinical context, the details that you want to know about your own health for you or your loved one, that's where there still is a lot of uncertainty. So one thing that we do know, and one of the questions that some people asked is there a dose-related effect? Like if a lot of probiotics work, if you lower the dose, will it still be effective? And the answer is that there is a dose-related effect. So you need to be taking enough of these live organisms to have the beneficial effects. And in some products, there aren't enough of these beneficial microbes present to have the beneficial effect that's been observed in the experimental setting. So in general, many people in many parts of the world take probiotics as part of their healthy daily living. It's in fermented foods, and people have lived with live organisms in products, including beer and wine, for millennia. But it's not at the concentration that we're talking about in where doctors and researchers are looking at these beneficial microbes in the intervention, either to prevent or manage disease conditions that can involve the gastrointestinal tract, but even beyond the gastrointestinal tract, including cold-like symptoms, eczema, those kind of things. So a little bit about the organisms that we live with. There are new techniques that have allowed an explosion of scientific knowledge about the microbes that live with us in health and disease. So we know when the baby is inside the mother's womb that the intestinal tract is pretty sterile. Now, even that is under some question now. There might be very small numbers of organisms, but there are not many bacteria present in the along the gastrointestinal tract until after birth. And how the baby is born has a major impact on the organisms that colonize the mouth, the stomach, the small intestine, and the large bowel. So a baby born vaginally acquires mother's flora, and if the baby is born by cesarean section, it's quite a different flora. And we know that babies that are breastfed have a very different microbial flora in their intestinal tract than a baby who is formula fed. Other things like whether the baby is getting antibiotics also have an impact. Now that's true in the first year of life, but that also more and more is being recognized as true even later in life, that what one eats, if you're a vegetarian versus a meat eater, there's a different, there is an impact on the microbes that colonize your intestinal tract. If you're on antibiotics, even for a couple of days, especially oral antibiotics, there is a change in the microbial composition. In most individuals, that's for a very short period of time, and after you come off the antibiotics, it goes back to normal. But in some individuals, especially the elderly, there's an alteration in the flora that does not revert to normal. Now, you probably all know about that, even though you may not have realized it was related to an altered flora, because many people, when they go on a course of antibiotics, say for an ear infection or a throat infection or bronchitis, notice that their bowel motions become looser in consistency, even sometimes diarrhea. And that change in bowel composition is related to the microbes that colonize the intestinal tract, the transient change in the colonization. The other thing that we've learned is that the composition of the microbiome is very important in maintaining health of the intestinal tract, and that if one has a reduced composition, that is less diversity in the composition of the intestinal microbiome, there is that's associated with a variety of disease conditions. And one of the concepts of using beneficial microbes, probiotics, is that this is a step towards restoring the microbial diversity, bringing the composition of the intestinal flora back towards a healthy state. So the bacterial fingerprint that all of us have occurs after birth and with the first feed. After a year of age, the microflora is quite stable in healthy individuals, but it can be altered in disease conditions. And in fact, there is very strong evidence now that the microbiome of the intestine is altered in a large variety of conditions, including IBS and IBD. But what we don't know is whether that's cause or effect. In other words, is the change in the microbial composition simply because of the underlying condition, or did it actually cause the underlying condition? And we don't have the final answer. The final verdict is not yet in. What we do know is that taking probiotics, at least after a year of age, can alter the composition of the microbiome back towards a more diverse, closer to what healthy individuals have. When one takes probiotics, it is temporary after a year of age for sure, because once an individual stops taking the probiotics, they're rapidly cleared from the intestinal tract. So it's not a permanent change in the intestinal flora. It's a transient alteration depending on the type and dose and frequency of ingestion. So the probiotics colonize different parts of the intestinal tract, as do normal microflora. So there is a complex mixture of organisms present in everybody's mouth. It's present in healthy individuals, and that oral flora is altered in individuals who have halitosis, for example, or periodontitis, which is weakening of the bones, bone structure supporting the teeth. There's a small number of organisms present in the tube taking food down to the stomach, called the esophagus in this picture. There are small numbers of organisms in the very acidic stomach and more in the small intestine. But the big factory of bacteria present in all of us, in all healthy individuals, is sitting in the large intestine or the colon. And that's where poop or feces is formed, and when you have a bowel motion comes out the bottom end. And it's this large intestine that's full of organisms that are controlled by how we were born, acquired from our mother, and impacted by normal contractions, acid production from the stomach, and the connector. This is the ileocecal valve, the connector between the small bowel and the large bowel. So in general, bacteria are present in the inside. They're not contacting the wall. They're in the lumen, creating the poop and changing the color of after you've ingested the nutrients in food that create bowel motions. So that's in the healthy situation. When there's an alteration in the flora, in the large intestine, for example, the term that's sometimes coined for that is dysbiosis, an alteration in the microflora, so that the balance between healthy and pathogenic or abnormal bacteria present in an abnormal condition are altered. And it turns out that that's very well known in the setting of an infection, where the pathogen takes over, colonizes the intestinal tract transiently. There's a marked reduction in the diversity of the intestinal flora, and it comes back to normal over a period of age. But in fact, over a period of time. In fact, there's more and more evidence that this is also true in a variety of human conditions, including obesity, diabetes, necrotizing enterocolitis is a condition in premature infants where there's an alteration in the microflora, and there's pretty good evidence from around the world that probiotics can help prevent the frequency and severity of necrotizing enterocolitis. I'm happy to discuss that more if people have questions about that particular condition. But I think most of the people on the call tonight are interested in irritable bowel syndrome and inflammatory bowel diseases. So the rest of my presentation will really talk to those areas. So the emerging theme in all of those areas is a reduced diversity is not a good thing, and having a more diverse, healthy composition of bacteria in the intestinal tract is a good thing. And so in each of these conditions, researchers are testing the benefits of employing probiotics or beneficial live microorganisms to restore health or prevent disease. Those are two possibilities. So in a nutshell, this is a lot of work by a lot of researchers. How might probiotics work? Now, it turns out that one of the things that we've realized over the last few years is that not all probiotics work the same way. So some probiotics will have one effect, and another probiotic will have a totally different effect. So depending on the condition one's trying to prevent or treat, an infectious condition, for example, versus irritable bowel syndrome, one might want to tailor the choice of probiotics depending on their mechanism of action. So some probiotics prevent pathogenic bacteria from colonizing, that's growing and replicating in the intestinal tract, and binding to the surface and causing disease. So that's called competitive exclusion. Other probiotics block the uptake of bad things through the intestinal barrier. Other probiotics impact on the immune system, and they can impact on the immune system in the intestinal tract, and they can impact on the immune system in the body as a whole. And that concept is maybe how probiotics taken orally through the gastrointestinal tract could have a beneficial effect on upper respiratory tract infections and skin conditions like atopic dermatitis or eczema. So there is the possibility of not only a local effect of beneficial microbes, but an effect in the entire body. So that, in a nutshell, is various aspects of how various probiotics work. So these are, I hope you can read the print on your slides. The definition of a probiotic is that it's alive, it's defined and properly named, it's safe for human conditions, And regulators want to know very much whether it's going to be put in food, whether it's going to be given as a dietary supplement, or whether it's used to be treating or preventing diseases in humans where it may be considered a drug. So some examples, I mentioned bifidobacteria and lactobacilli. These are just some of the product names that are out there. But there is also an E. coli strain in Europe that is used. That's the E. coli Nissl 1917. And the yeast product in the bottom right of the slide is the Saccharomyces boulardii. So all of these have been used for conditions in humans. So irritable bowel syndrome is a very common condition impacting the quality of life of many Canadians. We don't know the underlying cause, but it certainly causes lots of symptoms, including abdominal pain and altered bowel habits, and an acute infectious process might be a predisposing cause to irritable bowel syndrome by causing dysbiosis. So rather than a short-term change in the microflora, there might be individuals impacted who have a long-term change in their microflora of the intestine after an acute infection. Some of the best research in the world suggesting that this is so actually comes from Canadian researchers looking at how common irritable bowel syndrome is in Canadians after an acute infectious insult compared to household and community members who did not develop the infection. And it looks like an acute infection does alter the microbiome, and it does result in less diversity and intestinal symptoms. So can probiotics help in irritable bowel syndrome? There is more and more evidence that this is the case. It's not everyone is convinced, but there is sufficient data from trials in which adults have been entered into studies where some individuals, without knowing, took live bacteria, and other individuals were randomized to receive a product that looked, and you couldn't tell in advance whether they were on a probiotic or a dummy preparation, which is called a placebo. And in those randomized controlled trials, there are at least 2 products that Health Canada has looked at and will be approving for use in treating symptoms of irritable bowel syndromes in adults. And the Canadian Association of Gastroenterology is presenting this to gastroenterologists at the meeting of gastroenterologists that's taking place in Montreal in February. So this is information hot off the press. There is the same kind of information with randomized trials in children with irritable bowel syndrome, different products than the ones that have been approved in children in Canada. These studies in children were done in Europe and United States, but the same idea holds true that the probiotics might improve symptoms. And then it's not clear that colic is the same as irritable bowel syndrome, but there have been studies looking at fussy or irritable babies, infants usually between 3 and 6 months of age, and some preliminary evidence, very recent as you can see, suggesting that probiotics might be better than a placebo or sugar pill. Now, inflammatory bowel diseases, I mentioned, is most commonly ulcerative colitis and Crohn's disease, impacting lots of Canadians. In fact, Canada has one of the highest frequency rates in the world of IBD, and we're not sure exactly why. It's a chronic condition with lots of symptoms that impact on individuals' quality of life. And the management can be quite difficult for a subset of individuals, and lots of interest in new approaches to treatment. So can probiotics help in the setting of ulcerative colitis and Crohn's disease? I think the tentative answer is yes, but that we need more information. So they're actually in the setting of ulcerative colitis, which is inflammation in the large bowel, usually with bloody diarrhea. It can have crampy abdominal pain as well. there is some high-quality trials suggesting that if the ulcerative colitis is under control, that probiotics help to keep it under control. And there's additional evidence that for those who are having a flare-up of their disease with clinical symptoms, that probiotics may actually be effective in helping bring the disease under control. In Crohn's disease, the evidence is not as compelling. In fact, many individuals would say the preponderance of evidence is on they're not helpful. This is a source of some debate, a lot of criticism of the quality of the studies that have been done in the setting of Crohn's disease related to the choice of probiotic that was given, how much of the probiotic was given, how ill the individuals were. Was it used to prevent disease versus prevent a flare-up of disease versus to bring active symptoms under control? So those are some of the variability factors that could account for the mix of positive and negative results. And rather than giving up on the potential benefit of probiotics, I think the evidence is for more data. In other words, we need more studies to assess the possibility of using probiotics in the setting of Crohn's disease. It may also be that probiotics are not going to be the holy grail and won't be used in isolation, but they might be a potential adjunct, in other words, complementary therapy in addition to the more standard medical options that are employed. So this is an experimental study, so I won't go into too much detail other than to say it's an animal model of colitis. And the white is the barrier function. The white bar is showing barrier function, and in the black bar next to it shows that with colitis, the barrier function is impaired, so there's increased permeability, which is the black bar going up. And if you give these experimental animals probiotics well in advance, that's the next bar over, right at the same time as the insult or right after the insult, you see that they reduce the damage to the intestine. But if you start taking the probiotic well after the insult has occurred, you no longer see the beneficial effect. So this experimental study suggests that timing is critical. And we know this for other intervention strategies, for example, antibiotics to treat an infection. The earlier you give it during the course of the illness, the more likely you are to see a beneficial effect. And the later in the course of infection, the less likely one is to see a beneficial effect. So timing is important. Challenges to using probiotics. There are lots of companies and researchers involved in looking at these issues. One is it's very important that the bacteria stay alive. We think it's important that the bacteria be alive, so keeping them in a preparation where they're stable and people are willing to swallow them or drink them in doses that are high enough to have an impact is important. And it turns out that there have been some studies, particularly from Ireland, showing that a low dose in irritable bowel syndrome has no effect better than placebo. If you up the dose of probiotic to a higher concentration, you see a benefit better than the sugar formulation. But if you give an even higher dose, there's absolutely no benefit. And the reason for that issue is that the release from the probiotic formulation is impaired when going to a much higher concentration. So the formulation of the product that's used is really, really critical. There are a lot of variations in the probiotics that are out there on the market. Some of them, in fact, most of them, I guess I would say, are one or two organisms given together. But there are, not always in Canada, but in other parts of the world, mixtures of probiotic preparations where up to 8 different bacteria can be given in combination in huge concentrations, orders of magnitude what you would find in foods, and orders of magnitude higher than what in the single probiotic strain preparations. The issue of safety has come up, and it's very important using live organisms to be careful that no harm will come to individuals who use them. We know that in the low concentrations in foods, they've been taken for thousands of years, and the risk of serious infection is low, but it's not zero. There have been reports of individuals, usually those predisposed to infection and very ill with other conditions, developing a infectious process. That's the second line there. In particular, people who have damaged a shortened intestine have a central line in place, and individuals who have really markedly impaired immune system. A few individuals did ask about lactose intolerance and milk protein allergy, and there are not all of the preparations, but some to many of the products that are available in North America, the commercial preparations, the bacteria are prepared using a cow's milk protein base. So there have been some theoretical concerns about an allergic reaction. It's protein, so it's not the lactose, the sugar in milk. So it shouldn't be related to lactose load. And in fact, there are some nice studies suggesting that certain bacteria, probiotic bacteria that utilize lactose, that they might be beneficial to individuals who are lactose intolerant. So here, this is not lactose intolerance. This is concern related to an allergic response to those who don't tolerate cow's milk protein. This next slide is just showing you what I talked about, the formulation strategy, going right to left. The low dose and the medium dose dissolve in a mixture of acid and bile acids, mimicking what's in the lumen of the intestinal tract. And look over here on the left. It's the highest concentration of probiotics, but it's so packed together in this capsule that nothing's released in a mimicker of what's in the intestinal tract. A rare complications of probiotics, and by rare I mean really, really unusual, are infections in the bloodstream that cause serious infections. And in people with IBS and IBD, unless they've had a very complicated illness with short bowel and a central line, I don't think that any of these have been reported in adults. So in this presentation, I hope I've made it clear that not all probiotics are equal, that there are variations in strain and how they might work. So because benefit has been shown with one strain doesn't mean that it will work, that the other strains will have the same beneficial effect, or that that strain that had a beneficial effect in one condition will work in another condition. We think that dose is very important. That is how much, how often, when you take the probiotic organisms is critical. But the precise details I can't give you because we just don't have them. We need more research in this area. And which strain to choose? Should it be a product that has a single organism or a product that has a combination of organisms? Researchers in the field can't come to an agreement, and I've seen where it even came to a vote among experts, and the split was right down the middle, 50-50, with half the experts saying single strains were the way to go, and the other half saying the mixture of strains were the way to go. And usually when there's a lack of consensus like that, that's just because we don't have enough information, and we need more details. The second point is that probiotics might not be used alone or as substitutes for current treatments, but they might be used as adjuncts or additional therapies in combination with current treatment regimens. And that's a strategy that healthcare providers often use. It's not either or, it's a combination of approaches that might be better than any one approach alone. So certainly before considering using probiotics or other complementary and alternative medications, certainly in the setting of a disease condition where you're already being followed by a doctor and have a medical condition, it's most appropriate to discuss that with your healthcare provider. So with that, Catherine, I think I hope I've address many of the questions that have been raised, but I'm happy to go through the questions and take more questions if I haven't been clear in my presentation for individuals.
That's great. Thanks very much, Dr. Sherman. So many of you sent questions through before you registered and as well once we actually started the session. And I think Dr. Sherman has answered some of them as he's gone through his presentation, but I think it's worth asking some of them a second time just to make sure that we're all clear on what the response is. So if I have a question that's already been answered through Dr. Sherman's presentation, please just bear with us and we'll try to get through all of them. So Michael has sent in a question saying that he's heard that the good bacteria crowd out or get rid of the bad bacteria, and that this is why it's important for us to take probiotics. He wonders, is there any literature that we can read that actually explains or further expands on what you presented today to help us better understand what actually happens in the gut and the battle between the bacteria?
So that's what I described as colonization resistance. So after a year of age, one has a microflora that is comprised of somewhere between 500 and 1,000 different bacteria. And one tends to have those for life. And they're good for us because they crowd out things that want to get in and cause trouble, but they also crowd out probiotics. So that's why when you take probiotics, they're only there for the period of time that you take them. After you stop taking a probiotic agent, it doesn't colonize long term. Now, you might think that that's bad, but actually regulators at Health Canada who are worried about or charged with making sure that our health is maintained think that that's a good thing, because if something untoward were to happen, that's an easy way to manage the probiotic is just to stop it, because then it will be cleared. So that mixture of organisms that we have in our intestinal tract do crowd out the bad bacteria. Not always, of course, because that's what happens when you have a intercurrent intestinal infection, a diarrheal disease, when you, like, for example, if you travel to Mexico and come down with traveler's diarrhea, where the pathogen takes over despite the mixture of organisms that are there. But the concern is when one goes on antibiotics that one loses the diversity of good bacteria and therefore less likely to crowd out the pathogen that's present.
Okay. And then Ruth would like to know, how long do we actually need to take a probiotic, and if there's any negative effect if we take more than what's needed?
Yeah, so how long we don't know. The one, and I think part of that question might be, do probiotics lose their effectiveness if you keep taking them? And so it depends on the condition. So in the setting of irritable bowel syndrome, most of the studies have only gone on for a relatively short period of time for a condition that's years and years of symptoms. So we need additional studies to evaluate whether the probiotics will continue to be beneficial taken on a daily regimen, or whether it would be better to rotate them or to go on and off. So a very good question for which, as far as I know, that research has not been done to provide the answers.
Okay, great. And then Julie would like to know if the probiotics that we can buy at a health food store, if they are good enough to treat Crohn's, and what strength would you need to get?
Yeah, so everybody's clear on the line. So I'm a traditional doctor following the scientific basis for doing studies, and so I'm not an expert on health food stores, and so it's not totally in my area. It has been said, though, that when people have taken products from health food stores and tested whether there are live bacteria present in the formulations, that there are very few or no live bacteria present. So I think what that says to me is one needs to be sure that the preparation has in it what it's supposed to have, doesn't have anything else in it that it's not supposed to have, and in the concentrations. So there has to be a quality control measure. And I'm just not sure that that's present in the health food stores.
Okay.
How's that for a waffling type answer?
And Christian would like to know that in some stores, probiotics are kept refrigerated and some are kept on the shelves at room temperature. What do we need to know about storing probiotics?
Yeah, so that is a big issue because bacteria, the ones kept in the refrigerator definitely have a longer shelf life, but it does depend on how the probiotic is prepared. So there are manufacturing techniques that can be employed to keep organisms at room temperature in a condition where they will become viable when they're ingested into the human setting at that temperature and in the conditions of the intestinal tract. So it very much depends on the product and how it's formulated. A powdered, dry preparation with no specific way to preserve the bacteria won't be alive for very long, kept at room temperature.
Okay. And then another question is, are there any side effects like gas production or pain that's experienced when people are taking probiotics that we should be aware of?
Yeah, so in general, the probiotics that are used are not, some bacteria do produce gas, and so if you ingest some bacteria, they will produce gas. The strains that are that we pass as flatus, but the strains that are used in the probiotic commercial probiotic preparations are usually not those gas producers. So it should, in general, should not be causing worse gas. And if it's in the setting of irritable bowel syndrome, probiotics have actually helped gas and symptoms of bloating. Often those are associated with excess gas, and some probiotics have actually improved the symptoms of bloating. A related product called prebiotics is non-digestive. Now, prebiotics are not the same thing as probiotics. Prebiotics are not live bacteria. They're non-digestible sugars that can be used by bacteria and can be used by probiotics to promote their growth in the intestinal tract. And if those sugars are given in very high concentrations, those prebiotics can cause gas, because they promote the growth of bacteria that produce gas.
Okay, great, thanks. And then Kathy would like to know that if a person is going through a serious bout of ulcerative colitis, is it a bad idea to try probiotics? Will it cause the gastrointestinal upset to be worse?
I guess the answer that I know better is there evidence that it would make the ulcerative colitis better? The answer is there is some evidence that is the case. There's more evidence that if the ulcerative colitis is under control, that a probiotic will help keep it under control. But that wasn't the question. The question was, taking probiotics make the ulcerative colitis worse? And I must say I'm not aware of evidence that that's the case. But that's certainly something I would talk over with my doctor first. I couldn't give a 100% guarantee that it wouldn't make things worse, but I'm actually not aware of any evidence that a researcher has shown that that's the case.
Okay. And then we have another question that says, you've mentioned the use of probiotics for certain disease states, but if I'm a healthy individual, would you recommend using probiotics as on a preventative level as part of my daily diet?
Right. So the answer is we don't know. But that's what most of the products that are out there are for. So most people around the world don't take probiotics to treat a condition. They take probiotics to maintain health. And do they do that? Can't really tell you. Do they make one feel better or grow better or have stronger bones? There's lots of research looking at this. But the final answer is we don't know.
Okay. And then this is a question that's come through from several people, actually, and they say, every time I go on antibiotics, I get some sort of infection, and it's often a yeast infection.
Yeah.
Is there something that I can do with probiotics to prevent getting that infection?
Yeah. So there, and chose a few areas to talk about, but there certainly is a lot of interest in using probiotics in the setting of antibiotic-associated diarrhea, which is common when loose stools, when individuals go on, especially oral antibiotics. There's also a specific condition in which an infection takes over when one goes on antibiotics, called Clostridium difficile infection, and again, lots of interest in, and that's an altered microbiome where there's dysbiosis. So there's lots of interest in using probiotics for both antibiotic-associated diarrhea and this Clostridium difficile infection. And there's some promising studies suggesting that there is benefit of certain probiotic strains that are out there on the market. I know one of the individuals asked, well, how is it that if you're on antibiotics and you're taking probiotics, do the probiotics still work? And it turns out the probiotics that are used in the Western world, including Canada, are not allowed to have antibiotic resistance. They have to be sensitive to antibiotics. So if one is on an oral antibiotic and one is taking probiotic, it's probably a reasonable strategy to not take them at the same time, to spread them out to ingest them at different times during the day, because the oral antibiotics do have the potential to kill the live bacteria that are present in the probiotic preparation.
Okay.
The other, just along the line about keeping the bacteria alive, there was a question about, well, how is it do the bacteria actually, if you take them by mouth, do they actually get to where they should? Because wouldn't the acid in the stomach kill them? And wouldn't the bowel salts in the small bowel kill them? And the answer is yes. That's why they have to be taken in such high concentrations, because especially on an empty stomach, if there's no buffering with food or fluids, acid will kill lots of the bacteria, and luminal fluids in the intestine will kill them. That's our natural defense against pathogenic bacteria. So that's one of the thinkings about why the probiotics have to be taken in such high concentration, to make sure that you get enough of them down to the more distal part of the intestinal tract.
Okay, and that's actually a perfect segue into the next couple of questions, and I'm going to ask them together. The first one is, does having a higher concentration of the probiotic, the bacteria in the product, mean that it's a better product? And does having many different species mean that there's an accumulated benefit?
Yeah, so more is better. There is good evidence that the effect of probiotics is dose-related. And if there's a real benefit, that for most intervention products, that's true. There should be a threshold where there is a benefit, and then a little more would be a benefit. But there also is a plateau where above a certain level, you no longer see that benefit, either because it's not released or you've just maxed out on the. So there is a dose-response curve to using probiotics. Whether one strain should be used, or 2 or 3 or the 8, the final word is just not in, and this is a great controversy at the present time. I think most doctors, including infectious disease doctors and allergists, think that the 1 to 2 strains is the right approach. Most gastroenterologists seem to favor the multiple strain approach. And in a true Canadian fashion, I sit on the fence somewhere between the two. So I'm waiting for more evidence. I don't really know where the truth lies. I know when you're studying products and you want to see what causes the benefit and how do they work, it's way simpler to do that with a single strain than it is a combination of strains. But that doesn't mean that a combination might not be the way to go. So we just do not know the precise answer to that. A very good question.
Okay. Another one is, if probiotics are helpful if you're constipated, how do they not make your bowels worse if you're taking probiotics when you have diarrhea?
Yeah, so again, this may relate to the choice of probiotic. So it might be that some probiotics are helpful on, say, for example, lactose intolerance, which can give you gas and loose stools. and other probiotics may have an impact on the contraction response in the intestinal tract that help move intestinal contents, including feces, through the intestinal tract and out. So it's likely that the choice of probiotic will have an impact on whether you're trying to reduce gas and distension and pain, or whether you're trying to move things along the intestinal tract.
Okay. And then another disease-specific one, is there any evidence that probiotics can help people with celiac disease?
Yeah, I saw that question, and that's a good one. So again, I just don't know the answer to that. I think it's a great question, and we have to ask some other experts to come on the call for that one. As far as I know, the answer is no, but that's not an informed answer, because I just don't know the literature that says that it might. I think it's a great question. Some people with untreated celiac disease have lactose intolerance, so it's in that setting that probiotics might have some benefit. But for celiac disease per se, I don't know, and that question is going to send me back to do some more reading.
Great. Okay, and this is going to be our last question for the evening, and it is, what are your thoughts on the recent or planned Health Canada licensing changes for probiotic supplements? How do you compare how would you compare probiotic supplements to probiotics that are in foods like yogurt?
Yeah. Well, there's been a lot of concern about the indecision in the field about whether probiotics are can be considered a food, or whether they should be considered a drug or a medication. And I think the uncertainty has caused a lot of frustration for researchers and healthcare providers and for patients. And what Health Canada has come to is that if you're using these products to prevent or treat medical conditions, they should be treated as a drug. And I think that's actually a good thing, because it's going to move, it makes the research expensive, because the kinds of quality controls and levels of evidence that are required by a government regulator are high for a drug. On the other hand, it will give us the answers to the uncertainties that are in this field. So for intervening in conditions affecting the gastrointestinal tract like IBS and IBD, the move to considering probiotics as a medication, I think in the long run will prove to be a benefit to the field.
Okay, that's wonderful. On behalf of the Canadian Digestive Health Foundation, I would like to thank Dr. Sherman for sharing his expertise and insights with us, thank Activia for sponsoring this educational event, and of course extend our very special thank you to you for attending and joining us for this evening. I hope that you gained a better understanding of how probiotics work and what the potential for them to help us or hurt us, or help when we're treating disease and just maintaining a general good digestive health. So thank you very much, Dr. Sherman, once again for being with us, and to all of you for joining us. Good night, everyone.